Hi, thanks for joining me today. My name is Mary Harrison. I have a bachelor's degree in health from Ohio University, a certificate in gerontology. I'm a certified dementia practitioner. I'm also a certified independent trainer with Positive Approach for Care, Deepest Knows organization. I'm really glad that you were able to join me today. We're going to talk about empowering care, support for informal and unpaid caregivers. So, when you think about caregiving, what comes to mind first? Family, professionals, or both? For many people who are or have been caregivers, the first thing that comes to mind is the non professional caregivers, the people like themselves who are providing the majority of the care while people are living at home or living with them in their home. Now, next question is, have you ever been a caregiver? Have you ever had to provide care for a loved one? And what was that experience like? Were you providing intermittent short-term care for a parent or grandparent, possibly after a surgery? Were you providing long-term unpaid care, um, perhaps years, months, for someone who was just no longer able to do all the things for themselves that they used to do before? What was that experience like? What resources did you find helpful? What things did you wish that you had access to? How were your support systems? What was going on around you? Did you have professionals helping to meet the burden of care? Did you have other family members? How did you um, organize the care so that their needs would be met and that you could still maintain your responsibilities at home? So think about what that care was like for you. Now imagine what it's like for the people that we're helping, and what are some things that we might be able to do to provide additional support services for non-paid informal caregivers. How do you think unpaid caregiving compares to paid caregiving in terms of responsibilities of the caregiver and the impact? Um, Both unpaid caregivers and paid professionals provide essential care, but their experiences are different in several ways. Um, First, let's look at the responsibilities for unpaid caregivers. So these are your family and your friends that are providing care for someone. Typically, care for a loved one, a parent, a spouse, a sibling, or a friend. This is providing 24/7 long term support without formal training. Non paid caregivers often take on medical tasks, managing medications, wound care, with little guidance and no training, no formal training. Many times, the unpaid caregivers also handle household tasks, transportation, emotional support, and many times financial management. Paid home caregivers, like home health aides, nursing assistants, and nurses, they're going to work within set shifts, and they are trained to provide the care. So they know how to lift, how to make beds when people are still laying in them. They have training on what signs to look for, how to make sure the person is still safe at home. Unpaid caregivers are often trying to do the best they can without the same level of resources. Paid caregivers follow medical guidelines and professional standards. They may be assisting multiple clients in many different homes every day. So the unpaid caregivers are primarily focused on one person, one family member. The paid givers may be working 2 or 3 hour shifts across town, across different living environments like assisted living or skilled nursing. Paid caregivers generally focus on physical care needs, and they're not really concerned about financial and legal decision-making needs of their clients. It's not in their scope. What about the emotional and physical impact? For unpaid caregivers, there's a higher rate of stress, burnout, and depression due to emotional attachment. So you might have been a nurse and taken care of thousands of patients, but when you're trying to take care of your husband or your child, it's a completely different story. Unpaid caregivers have financial strain from lost wages and out-of-pocket expenses. They might struggle with role reversal, trying to make decisions for their parents, trying to provide basic caregiving and support for their parents. So this can be a real role reversal. Unpaid caregivers might neglect their own health and well-being. So paid caregivers have also high physical and emotional demands, but they have more boundaries than family caregivers. So they're only there for 2 hours a day. They're only there for 3 hours a day. Whatever it is, they are there for a limited amount of time, and they have very specific responsibilities. Unpaid caregivers face low wages, limited benefits, and high turnover in caregiving jobs. Oftentimes, these paid caregivers build close relationships with clients, and they also can experience grief and emotional fatigue when a client declines or passes away. They might experience workplace challenges such as unsafe conditions, difficult clients, or lack of career advancement. So what are some of the financial differences between unpaid caregivers and paid caregivers? Unpaid caregivers provide care without financial compensation, often at the cost of their career and personal savings. The economic value of unpaid caregiving was estimated at $600 billion in 2021. Many times, unpaid caregivers don't really know what financial support programs are available, such as Medicaid waiver, VA benefits, or caregiver tax credits. Paid caregivers also have some financial challenges. Generally, the wages are low with limited benefits, maybe $12 to $18 per hour pay. Many paid caregivers lack paid sick time. They lack health insurance despite working in healthcare. Many paid caregivers have to have multiple jobs to make ends meet, contributing to stress and turnover. Balancing both roles. When we look at unpaid caregivers and paid caregivers, we need both. Unpaid caregivers need more support, including financial relief, respite care, and mental health resources. Paid caregivers deserve higher wages, better training, and professional recognition. The goal would be to reduce turnover and improve quality of care. Social workers, policymakers, healthcare professionals need to advocate for both paid and non-paid caregivers to create a more sustainable caregiving system. So think about what policies or programs could improve conditions for both unpaid and paid caregivers. Are there resources that you know about that maybe you could share more freely with paid caregivers, both professionally and in your social circles? We mentioned the value of unpaid care. Let's just visit that again. Care provided by millions of unpaid family caregivers across the U.S. was valued at $600 billion in 2021. A $130 billion increase in unpaid contributions from the 2019 report. So in just 2 years, it increased $130 billion. This staggering figure is based on about 38 million caregivers providing an average of 18 hours of care per week for a total of 36 billion hours of care at an average value of $16.59 per hour. I don't know about you, but the last time I looked, finding someone who could provide that level of care at $16.59 an hour is going to be pretty difficult. I think this number is very low. This $600 billion valuation surpasses all out-of-pocket spending on U.S. healthcare in 2021, highlighting the critical role of family caregivers in the nation's healthcare system. The unpaid contributions of family caregivers exceed the total spending on paid long-term services and support, including post-acute care, which was at $531 billion. On average, family caregivers provide 18 hours of care per week, totaling 36 billion hours. Family caregivers often face financial challenges, with many family caregivers spending roughly a quarter of their income on caregiving activities. These figures emphasize the indispensable, yet often under-recognized contribution of family caregivers, highlighting the need for supportive policies and resources to assist them in providing their care. 75% of all caregivers are women. Let's look at the unique challenges faced by informal, unpaid caregivers in various relationships and discuss the emotional and practical aspects of caregiving that impact these folks. First, think about who are some unpaid or informal caregivers. Take a minute just to think about the people who are in this role. Informal and unpaid caregivers often take on the role of primary support for loved ones who are aging, who have chronic illness, or who face physical or cognitive limitations. Each caregiving relationship is unique, shaped by the caregiver's relationship to the care recipient and the nature of their bond. So we have spousal caregivers. So you're providing care to your husband or your wife. Or you can also include that to mean long-term partner relationships where you're providing care to your boyfriend or girlfriend. Adult children caring for parents is a large component of this. We also have siblings and friends as caregivers. We have nieces and nephews caring for aunts and uncles. Kindly neighbors, looking in, taking dinner. Church friends, people you know. Unpaid caregivers are often referred to as family caregivers. These individuals provide care to family members and friends with health conditions, disabilities, and aging-related needs, generally with receiving no financial compensation. In the United States, approximately 26.5% of adults are family caregivers. Let's learn some more about unpaid informal caregivers. Caregiver giving spans all age groups. A notable segment includes young adults. Approximately 1.4 million children aged 8 to 18 provide care for an adult relative, with 72% caring for a parent or grandparent. Again, women are more likely to assume caregiving roles, reflecting traditional gender norms and expectations. Many caregivers are trying to balance their responsibilities with an employment, often leading to adjustments in work hours or even having to leave the workforce. Caregivers frequently incur out-of-pocket expenses. So you have the cost of gasoline, driving people to appointments. You have the cost of being too tired to buy dinner or to make dinner, so you just buy it on the way home to your other responsibilities. Caregivers frequently incur out-of-pocket expenses averaging $7,200 per year. This can easily lead to financial strain, especially when you're having to pull out of the workforce to provide the care and services. Caregivers often provide an average of 20 hours of care per week, with variations depending on the care recipient's needs. Health implications. The demands of caregiving can lead to increased stress and burnout and health issues among caregivers. It's really important for us to understand who the caregivers are, what the challenges are, so we can support them in a formal way and help support policies and resources to assist them in this role. So what is it that caregivers do? Take a minute and think about what all the things are that a non-paid caregiver is responsible for. Many people often get that call at 10 o'clock at night because the remote's not working. So that's a big part of it. So it's anything that a person might need to live independently. So caregivers frequently assist with all of the critical daily activities. They help with bathing, with dressing, with feeding, with cooking and cleaning. All the tasks that are essential for quality of life for care recipients, especially those with disabilities or chronic illnesses. The nature and the scope of the illness is going to definitely impact how much care and when the care is being given. So pretty much everything that a person needs to do to be a person, caregivers are helping with. It's very, very challenging. Financial strain. Again, family caregivers often face financial strain. trying to manage all of the things in two households can be just overwhelmingly difficult. Caregivers for people living with dementia. So dementia causes unique challenges for caregivers. There are physical challenges, including managing behavioral changes, memory loss, and communication difficulties. The progressive nature of dementia means caregiving responsibilities increase over time, often leading to chronic stress, burnout, and increased financial strain. Caregivers frequently experience grief and loss while their loved one is still alive. This anticipatory grief can also lead to feelings of guilt when the person sometimes is just overwhelmed with all of the things that are going on trying to care for someone and wondering if death would be a release. Emotional and mental support for dementia caregivers is crucial. There are higher rates of depression and anxiety. Caregivers for people living with dementia experience mental health challenges at twice the rate of non-dementia caregivers. These folks need self-care strategies. We need to teach mindfulness, stress management techniques, and encourage them to seek counseling when needed. Encouraging participation in dementia-specific support groups, both in-line and on-person, can help. Helping caregivers navigate complex emotions, including guilt about placing a loved one in care when they can no longer stay at home, is vital. 60% of caregivers for people living with dementia rate their stress levels as high or very high, and 40% of these caregivers report depression symptoms. Emotional and mental health support for dementia caregivers. Again, dementia caregivers, people who are caregivers for people living with dementia, experience mental health challenges at twice the rate of a caregiver, someone who is not living with dementia. Some of the challenges include the person living with dementia might not even realize or accept the fact that they need help. This added level of complexity makes it even more difficult for a caregiver for someone living with dementia. So let's talk about considerations for non-paid family caregivers for veterans. Caring for veterans presents unique challenges and considerations due to the distinct experiences and needs that arise from military service. Family caregivers need to address service-related health conditions. Many veterans suffer from physical injuries, chronic pain, traumatic brain injuries, and mental health conditions like PTSD. All of these things that are directly related to their military service require specialized medical attention and a deep understanding of how they impact the daily life of the veteran. Veterans caregivers are often helping the veterans navigate Veterans Affairs benefits and services. The U.S. Department of Veteran Affairs offers programs to support family caregivers, such as the Family Caregivers Program. This program provides stipends, training, and respite care to eligible caregivers of post 9/11 veterans. It's important to understand these benefits, and it can be very complicated. Many times, families can feel overwhelmed. They just need to reach out to the VA to figure out what's available and how it could benefit their person. Non-paid family caregivers for veterans are often managing emotional and physiological dynamics. When a veteran has PTSD or other mental health issues, the family relationships can be very estranged. It can be very difficult to provide care for someone. It's important that people who are caring for veterans try to build a personal support network. Organizations like Tragedy Assistance Program for Survivors, or TAPS, offer resources to families of fallen service members, addressing needs such as grief counseling and advocacy. Engaging in organizations can help provide caregivers with essential assistance and a sense of community. Caregivers for veterans often are advocating for policy and legislative support. They need to engage in advocacy to ensure that veterans receive appropriate care and benefits. There are many programs to try to prevent suicide for veterans. There's just a lot going on, and we encourage all veterans, family members to reach out to see what services are available. The Veteran Service Commission throughout Ohio in every county can help provide support for this. It's important for family caregivers to stay informed about what's going on in the world, legislative changes, and participating in advocacy for all veterans can be very important. So these are unique considerations for veterans caregivers, and it's really important that we provide support so that their caregivers can access the services available. Caregivers of veterans report high levels of stress. 88% of caregivers, non-paid caregivers of veterans, experience significant emotional strain. Over 60% report deteriorating personal health due to caregiving demands. So this highlights the need for tailored support for folks who are caring for former service members. There's also special considerations if the non-paid caregivers and the patient who they're caring for are members of the LGBTQ community. These folks encounter unique challenges influenced by societal attitudes, healthcare disparities, and legal consideration. So first, think about discrimination and bias. LGBTQ caregivers may face discrimination from healthcare providers, leading to inadequate support and reluctance to seek necessary services. This bias can result in suboptimal care for both caregivers and their loved ones. And we are in an environment where there is increasingly more hostility towards this community. Legal and policy barriers that restrict access to gender-affirming care, such as executive orders recently, can create additional obstacles for LGBTQ caregivers and their families. These measures may lead to disruptions in healthcare and increased stress for the folks who are providing care and services. LGBTQ caregivers have an increased risk of social isolation. They're afraid of discrimination, and that can lead to caregivers to conceal their identities, resulting in social isolation and often provide limited access to supportive communities. This isolation can increase stress and hinder well-being for the caregivers. There's a lack of inclusive services. Mainstream caregiving services often lack cultural competence regarding LGBTQ issues, making it challenging for caregivers to find supportive and understanding resources. This gap can lead to unmet needs for caregivers and their person they're caring for, and increased caregiver burden. LGBTQ individuals with disabilities may face compounded discrimination, both in terms of their sexual orientation or gender identity and their disability status. This can result in even more challenges accessing appropriate care and support. LGBTQ elders are at a higher risk of abuse in caregiving facilities, including being outed without consent and facing homophobic treatment. This is abuse. This abuse can lead to increased fear and reluctance to seek the necessary care. There are some resources for support, like Services and Advocacy for GLBT Elders, SAGE, can provide some resources. Addressing these specific challenges requires culturally competent care, inclusive policies, and supportive communities to ensure the well-being of LGBTQ caregivers and the people who they're taking care of. Spousal caregivers. What are some of the unique things facing spousal caregivers? Spousal caregivers are the people who are providing care to their partners. They face unique challenges that can impact their physical, emotional, and financial well-being. We have emotional and physical strain. Caring for a spouse often involves managing complex medical tasks, leading to increased stress and the potential health issues for the caregiver. The intimate nature of this relationship can intensify feelings of exhaustion and emotional fatigue. Financial burden. Many spousal caregivers have to reduce their work hours or leave their jobs to provide care. Obviously, this is going to result in lost income and financial instability. The rising costs of in-home care, with national and median rates reaching $33 per hour, further magnify financial pressures. Social isolation. The demanding nature of caregiving for your spouse can limit social interactions, leading to increased feelings of loneliness and isolation. This isolation is often more pronounced among caregivers of individuals who are living with dementia, where nearly 2/3 report experiencing loneliness. When you are a spousal caregiver, your role changes and your identity shifts. We are transitioning from a spousal relationship to a patient-caregiver dynamic. This can alter the emotional connection and the intimacy between partners, leading to feelings of loss and identity confusion. Health risks. Chronic stress associated with caregiving can result in sleep disturbances associated with a weakened immune function and a higher risk of chronic illness. Caregivers often neglect their own health, and it makes these things worse. Lack of support and resources. Navigating healthcare systems and accessing support services can be challenging, especially when caregivers are unaware of available resources or face barriers to accessing them. When we recognize these challenges, recognizing these challenges is crucial for developing interventions and support systems that address the needs of spousal caregivers, ensuring their well-being while they care for their partners. Special considerations for long-distance caregivers. Long-distance caregivers, essentially those folks who are providing care for a loved one from afar, have another unique set of challenges that can complicate the responsibilities. Number one, there can be limited direct supervision. If you're geographically distant, it makes it more difficult to monitor the care recipient's daily condition and needs. This lack of direct oversight can lead to delays in addressing health issues and changes in a person's well-being. Coordination of local services. Long-distance caregivers have to arrange and manage local services such as medical appointments, home care, and emergency responses. It's more complicated and difficult if you're not physically there. This often requires reliance on local contacts or services, which may or may not be as reliable or available as they would be. Emotional stress and guilt. The inability to be present can lead to feelings of guilt, anxiety, and helplessness for the long-distance caregiver. They may worry about not doing enough or feel distressed about their loved one's well-being. Financial strain. Long-distance caregivers can incur significant expenses, including travel costs, hiring local assistants, and potential lost income from time taken off from work. These financial burdens can add to the stress of caregiving. Communication barriers, including time zone differences and varying schedules, can really impact timely communication with the care recipient and local caregivers. This can lead to misunderstandings or delays in decision making. Technological challenges. While technology offers tools like video calls and monitoring devices to assist in caregiving, not all elderly individuals are comfortable using the technology, which can limit their effectiveness. There can be limited support networks. Long-distance caregivers might lack local support systems, making it harder to share responsibilities or seek respite care, which can lead to caregiver burnout. So when we address these challenges, it requires proactive planning, looking at how we can use technology appropriately and how to build a reliable support network while maintaining open lines of communication to ensure the well-being of the caregiver and the care recipient. What are some of the practical challenges for caregivers? One of the first ones is time restraints. Unpaid caregivers often dedicate substantial time to caregiving duties. with the national average being around 22 hours a week. That is half the time that you spend at your actual job, you have a second job on top of it. This commitment can limit their availability for personal activities, for employment, and leisure, leading to reduced quality of life. Another practical challenge for caregivers is the physical and emotional stress that the demands of caregiving often bring. There are physical, emotional strain. Caregivers experience exhaustion, anxiety, and depression due to the continuous responsibilities and lack of a break. Social isolation. The extensive time devoted to caregiving can lead to social withdrawal, as many caregivers don't have limited opportunities to engage in social or recreational activities. This increases feelings of loneliness for the caregiver. Another practical challenge for caregivers is the simple lack of training. Many caregivers are unprepared for the medical and logistical tasks required, such as administering medications, managing appointments. This can lead to increased stress and potential health risks for both the caregiver and the care recipient. Some of the emotional needs of caregivers, stress and anxiety. Juggling caregiving duties with other responsibilities creates constant stress, leading to anxiety about the health and well-being of the person that they're caring for. Depression. We discussed the isolation and overwhelming nature of care. This can result in feelings of sadness, hopelessness, or even develop into depression. Guilt. Many caregivers often feel like they're not doing enough or that they're not meeting their loved one's needs, even if they're giving it their best effort. Burnout. Constant caregiving without time for self-care or relaxation can lead to exhaustion, emotional numbness, and a sense of being overwhelmed. Loneliness. Many caregivers feel isolated as their time is consumed by caregiving duties, and they may withdraw from social relationships due to lack of time and energy. So what are some of the financial challenges for caregivers, for these non-paid family caregivers? Out-of-pocket expenses. Caregivers often incur significant costs related to medical supplies, home modifications, and other care-related needs. On average, unpaid family caregivers spend around $7,200 annually on caregiving expenses. This can be equated to around 26% of their income spent on caring for someone else. The impact of caregiving on employment is huge. Caregiving responsibilities can interfere with employment, leading caregivers to reduce hours or leave their jobs entirely. This disruption can delay retirement by 7 to 21 years, depending on the caregiver's salary and the extent of the caregiving duties. There's often a reduced retirement savings. The financial strain of caregiving often results in having less contributions to retirement funds, potentially leading to a 40% to 108% deficit in retirement savings by the age of 65. This shortfall can jeopardize the caregiver's future financial security. The stress associated with caregiving can lead to health decline in caregivers, contributing to an annual $28.3 billion annually, additionally to healthcare costs. So the stress of caregiving can lead to declines in caregiver health, contributing to a $28.3 billion annual healthcare cost. This additional financial burden just exacerbates the economic challenges faced by caregivers. How do we address these challenges? We need comprehensive support systems, including financial assistance, access to respite care, and training programs to equip caregivers with necessary skills. We need to recognize and support unpaid caregivers as essential to providing the care and services that people need to stay at home. So let's look at some strategies for effective communication. Communication is vitally important as we work to support caregivers and caregivers work to support the people they're caring for. What can we do? We can have structured communication tools like the SBAR, Situation Background Assessment Recommendation, so we can standardize information exchange. We conduct interdisciplinary bedside rounds that involve caregivers and promote collaboration and ensure that caregivers and the people receiving the care recipients, are informed about care plans. We can practice active listening. Encourage caregivers to express concerns and listen attentively. This fosters mutual respect and understanding. We can provide educational resources by offering training and informational materials to help caregivers. We need to help them understand medical conditions and care techniques. We need to let them know what they might expect as the disease progresses, what services are available, and how we can teach them how to physically provide the care. Do things like helping someone safely get in and out of the shower, helping someone get on and off the toilet. What are things that would be necessary for them to stay at home? Effective communication can help us ensure cultural competence. Being aware of and sensitive to cultural differences builds trust and improves our overall communication. So, as we're looking to support people who are non-paid caregivers, what can we do to assist when stress comes in? So, what are some strategies for assisting informal, unpaid caregivers in managing stress, maintaining their own well-being, including how to set for boundaries and ask for help? Only 14% of unpaid caregivers utilize respite care, even though it significantly reduces stress and burnout. So what can we do? As healthcare providers, there are several ways to recognize and address caregiver stress and burnout. Check in with caregivers. During patient visits, don't just ask about the patient's health. Include questions about the caregiver's well-being as well. Be proactive. Ask how they are coping with caregiving responsibilities. Have a discussion about what's being done. Is there anyone else who could do it? Any other agencies? Are there anything that could be put into place to give them more support? Encourage self-care. Remind caregivers they need to care for themselves in order to care for others. Encourage breaks, exercise, and social engagements. Offer resources on stress management techniques. Provide information and resources. Make caregivers aware of community resources like support groups, respite care services, and counseling. Let them know they don't have to do it alone and that help is available. For instance, if someone is a veteran, the veteran services often cover caregivers to come in and provide support at home, and they also cover adult day services so that the person could be somewhere else for 1 or 2 days a week so that the caregiver would have a break. Promote open communication. Create an open and non-judgmental space where caregivers can share their frustrations and struggles without feeling guilty and judged. Empathetic listening can help caregivers feel understood and supportive. As we're working to assist informal unpaid caregivers managing their stress and well-being, it's important to identify early warning signs. Be on the lookout for signs of burnout. So when you think of burnout, what do you think of for like some warning signs? Irritability, fatigue, disengagement. Maybe they're missing appointments. Maybe they're not taking their medication properly. Early intervention, recognizing these warning signs is a key to preventing further decline and supporting caregivers before they reach a breaking point. It's important that as part of our regular encounters with caregivers, we let them know about respite care. We encourage them to take time off, whether through respite care services or by organizing a team approach to caregiving. If you have a person in Ohio who's on Ohio Medicaid, there are respite services available so that the caregiver can have a break. The goal is to keep people home as long as possible, as safely as possible. And so many times this respite stay can increase the length of time at home by months or years. Caregivers need to be encouraged to recharge and restore their physical and emotional health. Another strategy to assist informal and unpaid caregivers, facilitate caregiver education. Educate caregivers about the signs of stress and burnout and teach them how to manage caregiving challenges. Provide them resources about caregiving techniques, stress management, and when to seek professional help. We need to be proactive about these conversations so that it feels normal and it feels like part of the care plan. That the way that we manage to take care of the person that we love is also by taking care of ourselves. So, as we look at all of these parts and pieces, the underlying thing is that effective communication matters. We need to be open and have those conversations. So, why does effective communication matter? It enhances care coordination. So when we're talking about care coordination, open communication, clear communication ensures that caregivers understand medical instructions, treatment plans, and care protocols, leading to consistent and accurate care delivery, and hopefully leading to a better outcome for patients while giving caregivers the tools to ensure that the things that need to happen at home happen at home. Effective communication builds trust and collaboration. We can have open dialogues that foster trust between healthcare providers and caregivers, encouraging that caregivers share observations and concerns, which can lead to better informed decisions. Open and effective communication can release and reduce stress and anxiety. When caregivers are well informed, they experience less uncertainty and stress, improving their emotional well being and their capacity to provide care. Effective communication helps facilitate early problem detection. Again, we want to find things when they're just a small issue, not when they have become a giant concern. If caregivers feel safe and heard, effective communication enables caregivers to promptly report changes in the patient's condition, allowing for early, timely interventions and preventing complications. Effective communication promotes cultural sensitivity. When we talk with someone, we get to know them, we can understand their backgrounds, and through open communication, we can ensure that the care is respectful and tailored to the individual client's needs. Effective communication empowers caregivers. Providing clear information and support empowers caregivers to make informed decisions, enhancing their confidence and their effectiveness in the role. So here's, again, just a summary. Effective communication matters because it builds trust. When caregivers feel heard and understood, they're more likely to trust healthcare providers and be open about their concerns. Again, effective communication matters because it improves the emotional well-being of caregivers, helping them manage stress, reduce feelings of isolation, and strengthen their resilience. And again, effective communication matters because it empowers caregivers by giving clear, respectful communication, helping caregivers feel more in control of their loved one's care, and it encourages them to seek help and take necessary breaks without feeling guilty. Again, let's look at some of the signs of burnout and stress in informal and unpaid caregivers. There are physical signs, fatigue and exhaustion. Caregivers may express chronic tiredness or an inability to get a restful sleep, even when they try. This can result from constant physical demands and a lack of time for self-care. There can be sleep disturbances, trouble falling asleep or staying asleep, experiencing poor quality of sleep due to the stress and worry associated with caregiving. Many times caregivers have headache and muscle tension, frequent headaches, back pains, and other physical discomforts caused by the legitimate physical strain of caregiving tasks or by stress. Many caregivers have changes in appetite or weight. Some caregivers may overeat and neglect their diet, leading to significant weight gain. Some people won't eat and they may lose weight. Changes in appetite can be triggered by stress or emotional exhaustion. There are emotional psychological signs, including irritability, mood swings, Caregivers who are overwhelmed by stress may experience frequent irritability and emotional outbursts. They might become angry and frustrated over small issues, which is an underlying sign of burnout. Many times, caregivers feel helpless, um, out of control, especially if they're unable to meet the needs of the loved one. Other emotional and psychological signs are anxiety and worry. Constant worry about the patient's health, the future of the caregiver's own health, can create a cycle of anxiety and depression. A caregiver may experience sadness, hopelessness, or lack of interest in activities that they used to enjoy. Depression is a serious risk if burnout is left unchecked. Behavioral and social signs to watch for might include withdrawing from activities. Caregivers isolate themselves from family, friends, and social engagements due to time constraints, exhaustion, or the sense of just being overwhelmed. Um, some behavioral signs to look for might be neglecting self-care, having difficulty asking for help, decreased quality of care of the person. Um, all these are important not only for the caregiver, but also because of the impact of caregiver burnout on the quality of care. Caregivers are the first line of support for individuals with chronic illnesses, disabilities, and aging-related needs. When a caregiver experiences burnout or stress, their ability to provide effective, compassionate care can decline significantly, which can have both immediate and long-term effects on the patient. Some of the impacts might include decreased physical care quality, missed medication. A caregiver who's overwhelmed may forget to administer medications or fail to follow through on prescribed medications, putting the patient's health at risk. Again, the effect of caregiver burnout on a patient can include decreased quality of physical care, poor hygiene and nutrition. If a caregiver is fatigued or mentally drained, they might neglect basic tasks like meal preparation, bathing, helping the person with mobility, which could lead to poor hygiene and nutritional deficiencies in the patient. There can be an increased risk of injury for the caregiver. If you're stressed and exhausted, you might make more mistakes, such as improperly lifting the patient, forgetting to make the space safe, leading to falls and injuries. There can be an emotional impact on the patient, increased frustration. Caregivers who are emotionally exhausted might be less patient or more irritable, which can cause distress and anxiety for the person being cared for. The person being cared for might feel a diminished connection to the caregiver. When the caregiver is burnt, they may struggle to show empathy, which can harm the connection between the caregiver and the patient. The patient might feel neglected and unsupportive. Finally, when caregivers become disengaged, they might stop providing the encouragement and emotional support that is essential for the patient's well-being. There could be a decline in caregiver health. The longer caregivers endure high levels of stress and burnout, the more likely they are to experience physical or mental health issues, which can lead to chronic medical conditions, mental health challenges, and hospitalization. And all of these things are going to impact how the caregiver can take care of the family. So some stress management strategies include checking in with the caregiver. Again, don't just ask about the patient, check in with the caregiver. Encourage self-care. Remind caregivers that they really need to take care of themselves in order to take care of others. Provide information and resources. Promote open communication. Help identify warning signs. Offer respite and caregiver education. Set boundaries and help them build a support network. So some strategies that social workers can implement to assist unpaid caregivers. Supporting these unpaid caregivers is a vital aspect of social work because these individuals often face significant challenges that can impact their well-being and the quality of care they provide. Number one, as a social worker, you can help provide comprehensive information and training, educational resources, offer information on medical conditions, caregiving techniques, and available support services. This is going to empower caregivers to perform their roles effectively and confidently. Social workers can facilitate training sessions to enhance caregivers' competencies in areas such as medication management, mobility assistance, and communication strategies. Social workers can facilitate access to professional support and counseling services. They can help connect caregivers to address emotional stress, anxiety, depression, promote mental health and resilience. Support groups. Social workers can encourage participation in support groups where caregivers can share experiences, gain insight, and build a sense of community. Social workers can promote effective communication, care coordination, ensure clear communication between caregivers and providers to align on care plans and expectations. Hopefully, this can help reduce confusion and enhance quality of care. Social workers can equip caregivers with skills to advocate for their care recipients' needs within the healthcare system. Advocacy is a huge part of being a caregiver. Social workers can help family caregivers assist in securing public and financial support. So, can you access your VA benefits? Are you eligible for Medicaid support and services in the home? Social workers provide resource navigation. Social workers can help unpaid caregivers access respite programs and other support services to alleviate economic burdens. Social workers can inform caregivers about policies and legislation that might offer additional support and benefits. Social workers are vital in encouraging self-care and respite care for caregivers. Under self-care strategies, social workers can educate caregivers on the importance of maintaining their health and well-being through self-care practices. Social workers can discuss respite opportunities and help the caregiver in finding care options for temporary relief from caregiving responsibilities, preventing burnout, including adult day services, short-term stays in assisted living, additional caregivers during the day just to provide services so that the caregiver gets a break. Social workers can encourage the utilization of technological tools. We can look at caregiving applications by introducing caregivers to mobile apps designed to manage caregiving tasks, track health information, and connect with support networks. We can look at the use of telehealth services, promote accessing medical consultations and support services in a convenient and flexible way. Social workers can foster social connections. Through community engagement, encourage caregivers to engage in activities that would reduce isolation and enhance social and peer support. Workplace flexibility, support initiatives that promote flexible work arrangements for caregiving, balancing employment and caregiving duties. Social workers are great at public awareness campaigns to raise the awareness of unpaid caregivers and the challenges that these face. So social workers play a pivotal role in the well-being of unpaid caregivers through the utilization of all of these things. Building a network, a support network for caregivers. This is important to help caregivers connect with respite programs, meal services, community volunteers, help them create a care plan and organize responsibility. Normalize seeking help for emotional, financial, and legal concerns of caregiving. Setting boundaries and asking for help, we can encourage caregivers to set limits and to define realistically what they can and cannot handle. Communicate this to other care partners. They need to learn how to say no, so we can encourage caregivers to decline additional responsibilities that might compromise their own well-being. We can help caregivers delegate tasks to family, friends, or community resources that can assist with specific tasks like transportation, shopping, and paperwork. Time management strategies. Social workers can help caregivers with time management. They can help them prioritize daily tasks, avoid perfectionism, use caregiver apps and calendars to schedule care and responsibilities. through, they can teach stress reduction techniques, guided meditation, time blocking. More than half of caregivers feel they have no choice in taking on caregiving responsibilities. So if we can help support them through time management strategies, hopefully we can reduce their stress and increase their efficiency and their sense of accomplishment. Okay, let's look at a case study. Sarah is a 32-year-old social worker and mother of two. She's a primary caregiver for her father, Frank, a 67-year-old veteran who has PTSD and who is undergoing treatment for lung cancer. Frank's PTSD was a long-standing challenge for the family, but Sarah is now responsible for managing his care during his cancer treatments, which has heightened his symptoms. What specific emotional and practical challenges does Sarah encounter in her caregiving role? How would her father's PTSD symptoms and resistance to outside help impact her caregiving experience? So specific challenges might be the PTSD management, especially because the resistance to care is going to make it just more difficult for her to do what he needs. Emotional needs and communication. Again, look at how social workers and healthcare providers can help Sarah feel supported and validated in her emotional needs. This might be the use of support groups or outside counseling. What role might empathy, validation, and active listening play in creating a trusting space for her to discuss her guilt and feelings of being torn between family responsibilities? What signs of burnout or stress might appear in Sarah's situation? How might her tendency to prioritize her father's needs over her own health and caregiving ability over time? So how might her tendency to prioritize her father's needs affect her own health and caregiving over time? And finally, what strategies might be effective for Sarah in managing her stress and balancing her responsibilities? How might introducing a support system, implementing boundaries, and accessing caregiver resources help her in sustaining this balance without compromising her own well-being? So essentially, we're going to look at what resources can we connect Sarah to so that she can better manage her stress and take care of her father without compromising her other responsibilities. This might include support system. It might include having the VA come in and provide more services. It might include her just opening up to having her dad go into some respite care so that she can manage her own personal responsibilities better. So what do you think you might introduce for her? What kind of symptoms of burnout might she have? All right. So as we've discussed in this presentation, unpaid caregivers provide a huge amount of care, support, and services in America and around the world. As social workers, there are things we can do to help caregivers have their needs be met so that they can continue to provide that care. It's vitally important that we recognize signs and symptoms of burnout and provide caregivers with the tools and strategies so that they can continue to effectively care for their loved ones. The role of the unpaid caregiver definitely changes based on who the caregiver is and who they're caring for. So if you're a spouse or a child or a neighbor, of course, all of the caregiving responsibilities are going to be a bit different. My email is on the screen. I invite you to reach out if you have any questions or concerns. I appreciate your time for the day. And again, looking forward to any feedback that you might have for me. Thank you so much.